Greetings from Washington, D.C. This is Peter Thomas, General Counsel of the NAAOP, National Association for the Advancement of Orthotics and Prosthetics. Here with our next webcast to bring you the latest developments in Washington, D.C. as they impact orthotic and prosthetics and the community of orthotic and prosthetic practitioners and patients. Well, we're on the precipice of the fiscal cliff, and Congress continues to debate in earnest a number of proposals to try to bring about a series of tax reforms and spending decreases to figure out how they can avert what they're calling sequestration or across-the-board cuts, which will begin on January 1st, 2013, if Congress does not implement some kind of alternative plan. On January 1st, a whole host of other provisions also take effect. A number of tax policies expire, and thereby raising taxes on a number of Americans, and a number of spending cuts go automatically into effect. And Congress is trying to figure out a way to replace the confluence of those policies with an alternative that will not slow the economy. And so there's been significant discussions over the last few weeks, and there will undoubtedly continue to be major top-level discussions to figure out how to resolve this impasse prior to the first of the new year. What's clear is that if Congress is not able to resolve the impasse and sequestration does go into effect, that will mean that for O&P practitioners, the O&P fee schedule will be decreased by 2%. As well as any Medicare provider's fees under the Medicare program will also be decreased 2% across the board. That's part of the law as it relates to sequestration, again, if Congress is not able to agree to an alternative by the first of the new year. Now, that doesn't include anything that already exists in current law, so that doesn't include whatever inflation adjustment for 2013 that will be received by the O&P fee schedule. And so it's a little too early to tell exactly what the real impact of that will be, but just so you know, 2% across the board decrease for Medicare fees for providers will occur on the first of the new year unless Congress acts to change that. It's not looking so good. In fact, the partisanship in Washington has not truly abated since the election. And in fact, just yesterday, there was a vote on the floor of the Senate where an international treaty on disability rights, which really parroted the Americans with Disabilities Act and applied that same standard in many respects to all the other nations of the world that had agreed to the treaty, failed to attract enough bipartisan support to pass. Something as kind of a no-brainer as that is a pretty significant wake-up call. If they can't agree to something, some legislation such as that, it's difficult to imagine they'll be able to come to agreement in a lame duck session of Congress on a much more comprehensive package of tax and spending provisions that are quite controversial. Having said that, we'll wait and see. It's simply too early to tell what the outcome of that debate will be. Meanwhile, the Department of Health and Human Services continues to issue regulations, and one of the key regulations they just issued recently was the Essential Health Benefits Regulation. It's a proposed regulation. Comments are due on the 26th of December. And the regulation really does a number of things that are consistent with how the department has treated this issue from the start. They're pushing as many of these decisions on essential benefits down to the state level and asking the state and telling the state that they have responsibility and the authority to create their own essential health benefits packages based on plans that currently exist in their state. So they're trying to minimize the disruption of the insurance market, and in so doing, I think the O&P community, has pretty good coverage with respect to that, but it's not ironclad, and there'll continue to be efforts at the state level to water down coverage in a variety of ways. So NAAOP is working on responding to the reg at the federal level, and certainly other O&P organizations are doing the same, but we would strongly request that you continue your state advocacy to try to get your state to maximize coverage of orthotics and prosthetics in their state benefit package. And finally, the Treasury Department, working with other federal agencies, issued a regulation that finally defined what the parameters of the medical device tax are. And I'm very happy to say that they pretty much exempted the field of orthotics and prosthetics. That's not a blanket statement, but the vast majority of the 2.3% manufacturer and importer tax created under that provision of the Affordable Care Act will not impact O&P patient care and O&P manufacturers and importers. So we wanted to congratulate AOPA for taking the lead on leading the charge on this issue. It's really great news that tax provision will not be applying to the vast bulk of O&P care, and it's welcome good news in a sea of risk that we see on the horizon. So with that, as soon as we know more on the fiscal cliff negotiations and how they may impact orthotics and prosthetics, we'll do another webinar as soon as possible. Thanks so much.